So it is now my pleasure to introduce our second speaker to you, and to hand over to our second speaker, Dr. Brindha Pullay.
Thanks, Vanessa. I would like to thank the organisers and Ovarian Cancer Australia for inviting me to present today. So as Vanessa mentioned, I'm a clinical psychologist at MacCallum Cancer Centre, and it's a pleasure to talk to you today about the psychosocial impact of living with ovarian cancer and how some suggestions about how to navigate this. So I'll start with a bit of an overview of the psychological impact of diagnosis and treatment for ovarian cancer on younger women. So getting a diagnosis of ovarian cancer may come as a bit of a shock, as ovarian cancer symptoms may initially be quite subtle and non-specific, and it might be attributed to other problems at the start. So, and also the treatments for ovarian cancer can be quite extensive and grueling, so like including surgery, a long post-operative recovery period, and aggressive chemotherapy at times. So given that women need to adjust to both, the physical tolls of the treatment that happens quite quickly, as well as the emotional impact of coming to terms with the illness, this can really predispose younger women to experiencing psychological distress, depression, and anxiety. And research has shown that psychological distress associated with ovarian cancer tends to be worse amongst women who are younger, who have been recently diagnosed, who have advanced disease or recurrence of disease or progression in their cancer. So I'll talk about one of the commonly asked about topics, that is the relationships with peers, particularly same-age peers. So clearly this is something that's hugely impacted by an ovarian cancer diagnosis. Often younger adults or people who are the same age as you may have little experience with dealing with an illness like cancer, and they may not know how to act around you. And a cancer diagnosis in itself may also be somewhat confronting to friends, because it's a bit of a reminder that cancer can happen to anyone, whatever stage of life you're at. And you might find that your existing friendships might change for a range of different reasons. So if you feel that, your friends who might be avoiding you or not being as connected with you as they were before, it can be helpful to sort of understand what those reasons might be. So for example, if they're not inviting you to be part of activities, they might think that you might not be able to go, or they might feel guilty about enjoying themselves if you're feeling sick, or if they're not visiting you, they might think, oh, you probably don't want visitors. So there often can be a few, misunderstandings and misconceptions about this. So this can make you feel quite isolated from your friends, and it might be necessary for you, to put people at ease and talk about the cancer diagnosis. So obviously you start with deciding what you want your friends to know. So you may consider sharing more information with close friends and less information with just acquaintances, and remembering that you are in charge of what you tell people. So you don't have to tell anyone until you're ready, of course, and you don't have to say more than you want to. But it's also important to recognize that despite all your efforts, some friendships will fade, and it might still be difficult for some people to understand your experiences with cancer. So it's important to focus on the friends who are able to support and listen to you. And talking with other women who share similar experiences can be helpful. In this case, joining a support group for younger women with cancer can be quite helpful. So I'm going to talk about relationships with family members, and I'm including partners into this, just to make it more concise. So because your partner or your family members may be primary sources of support, the cancer diagnosis can really have quite a huge impact on these relationships more than others. And also there might be pre-existing tensions within the family that can add complexity to the situation as well. So the diagnosis of cancer can not only, obviously it's overwhelming to you, but, it's quite common for family members to experience, a lot of sadness, frustrations, and that sense of helplessness and hopelessness as well. Of course, it's important to also recognize that, there's often that balance between wanting to be independent and also needing care and needing support from your family. So you might experience family members becoming quite protective and needing to talk to you more frequently, or, giving you a lot of unsolicited advice. But, it's in one sense, it's quite natural that parents and family want to protect you and talk to you. and take care of you, but it can also be important to assert your independence as well. So you gain some control back. On the other side, so for some families who face challenges of cancer together, they find that this strengthens their relationship bonds. So the uncertainty about the future, can help people, sort of really reevaluate their priorities and reinforce the importance of their relationships. And it can be really challenging to discuss certain topics relating to cancer. Even couples who might, typically communicate really well may have trouble talking about cancer because it involves a lot of intense emotions, and you fear upsetting the other person, or you feel, guilty about having certain negative thoughts. And some topics are naturally hard to discuss, so things like sexual problems, fertility concerns, physical limitations, or even the possibility of dying. But what a lot of research has shown is that if hiding feelings often creates more of a distance between partners and family members, and actually prevents them from supporting and comforting each other. So it can be quite important to actually broach the topic even when it feels difficult. So here are some very brief suggestions. So like I said before, it might be helpful to try and talk openly and honestly to a partner or family member that you are close to. And also, attempting to try and identify what different ways you might cope with the stress. So, for example, one person might view cancer as a problem to be solved, while the other person needs emotional support and validation. So both have valid responses, but there might be a different way at tackling or coming to a problem. And it can be helpful to sensitively listen to the other person's perspective as well, and expressing how you feel. It's also important to discuss practical concerns, so things like decisions about treatment options, changes to routines, changes to future plans. And my final point there is about, if you find it really difficult to broach these topics and to confront these things, it is important to seek individual counseling or family or couples counseling to help you with this process. So you might learn different ways to cope with the changes in the relationship and how to communicate this in a more effective way. So I'm going to move on to body image. So as you will know, as part of treatment, many women experience, bodily changes, including things like hair loss, and weight gain. And after treatment, it takes time for the body to adjust and, for you to go back to look to how you normally would. And even then, some changes might persist. So, for example, hair grows back, but it has a different texture or a different color, or it doesn't quite look right. And changes to your body after cancer treatment can, make you worry about your body image. And it is normal in that perspective to feel anxious and less confident, to feel quite angry, sad and quite helpless, or a combination of all these emotions. Some women even feel that, they're no longer the person they used to be, and they worry about relationships and feel really self-conscious. So the first thing to remember is that it's, you'll need time to adjust to these body changes, and it's important to be kind to yourself during this period of adjustment. Very commonly, people try to avoid situations that make us feel anxious. So examples of avoidance include things like, you avoid looking or dealing with a particular body change, or you decide not to go out at all, or you avoid looking at mirrors or shopping for clothes. And although this might be a relief in the short term, because, it can, you feel less anxiety, but it can make things more difficult in the long term, because it doesn't give you that chance to find out if facing your fear is as bad as you think, and that can keep the anxiety and the fears going. So if you do have a visible change, try not to delay, addressing it and looking at it. It can help, to talk about how you feel regarding these changes with someone that you trust, or other people who might be going through quite a similar experience. It's also quite important to gather some of the practical information about dealing with these body changes, and there is information out there. So speaking to your nurse coordinator or social worker can help with that. So when you take little steps of positive action to try and deal with each change, that can be quite empowering, because it gives you back some control among these bodily changes that it's completely out of your control. It can also help to remind yourself of the unique aspects of your identity. So I've said there, seeing yourself as a whole person. So often your family and friends will be able to tell, oh, these are certain aspects of your identity and personality that they come to love and appreciate. And although we often tie our appearance to our identity, it's important to remember that we have a whole range of other strengths and desirable qualities that continue to exist, even in the face of, these changes in terms of the physical appearance. So moving forward after treatment, so that's the point where it can also be quite a struggle. You might have less follow-up visits with healthcare professionals at that point, and your family might expect you to go back to being normal or how you used to be. And you might also have your own expectations of how you should be or what state you should be in physically and mentally. And this adjustment can be very challenging and quite isolating as well. And living with, that uncertainty about cancer and the future is not, it's never easy. Fearing cancer recurrence can make you feel very separate from other people who might be at the same stage of life from you. And it's important that you remind yourself that fear and anxiety are, a normal part of your survivorship. And worrying about cancer coming back is usually most intense probably in the first year after treatment. And what we find is that the worry often gets better over time. So there are a few quick, some quick strategies I've listed here to manage this fear of cancer recurrence. So the first step can include recognizing, your thoughts and emotions surrounding cancer coming back, and also knowing your triggers for increased anxiety. So whether this might be, watching a television program that talks about cancer or seeing your friends, on social media, getting through different milestones in their lives. So whatever those triggers might be, so just, being aware of what your triggers are. So being well informed, so finding out what symptoms you should pay attention to and what symptoms, that something that is not concerning. So being aware and getting that information from your treating team. Also discussing follow-up care with your healthcare team as well. So knowing what the plan is and knowing, when your follow-up appointments or how often they will be spaced out, and knowing what to do if you are concerned between, from one follow-up appointment to the other and who you might be able to contact. So that can sort of ease that anxiety. And the last point I said here, so that can often be underestimated. So finding ways to manage your everyday stress. So these can include, really simple things of having a bit of a plan of what to do when things get overwhelming. So even if that might be, sitting for a few minutes and doing a relaxation exercise, or, having a chat to a friend on the phone, or taking a walk in the park, or being in nature, whatever it might be that might work for you to help to manage that, the daily stresses that you face when you're coping with cancer after treatment. And so the last point I have on this slide is about the loss of identity. So it is understandable that the roles you previously tied to your sense of identity, like work, study, relationships, may have changed quite significantly during the process of being diagnosed and treated for ovarian cancer. So some people describe it as, this sense of emptiness and like experiencing a certain sort of vacuum inside. So it can help to, work through each aspect of your identity, each aspect that your identity was tied to, and coming to terms with how that might need to be reframed or changed in a certain way. So it might involve, establishing a slightly different sense of identity or a new sense of purpose. And to help with this process, it can be good to clarify what your core values are and what your beliefs are. So these things that are important to you, regardless of the roles that you held before, and making that commitment to act in accordance with those values that you hold dear to you. So talking through these things with others can be good, because sometimes we're often not aware even of our own strengths or our own values and beliefs. So, so that might be something you might like to explore as well. Yep. So thank you.
Thank you very much, Dr. Pullay, for that wonderful presentation. So we just have a couple of questions that have come up. The first one is, how can I access a psychologist, and how do I know if he or she will be appropriate for me?
Yep, so there are a few ways they can go about seeking psychological support. So the first port of call, I would say, would be approaching your treatment team. And they often have psychologists that they refer patients to. So in that sense, you have that recommendation from someone that you trust that can help. There might be a psychology team in the institution that you're getting the treatment from. Otherwise, your treatment team can refer you to a psychologist in private practice as well. And the second option would be going on to the Australian Psychological Society website. And there's a tool there that says find a psychologist. And you can actually search for a psychologist who is in your area, and you can check a box that says, has expertise in cancer or health problems. With regards to knowing whether the psychologist is appropriate for you, you only know that from, attending 1 or 2 sessions and trying, to be open and honest with the psychologist about how things are going for you. And of course, we all connect in different ways with different people. So if you do find that a psychologist isn't a good fit or you don't feel comfortable, there's nothing wrong in expressing that and trying to seek support from someone else who might be a better fit. So it's just important to give it a go and see what works for you.
Fantastic, thank you. And just one more question. Do you know of any support groups for women in their 30s who have been facing cancer with pre-existing mental health problems?
So that's very specific, isn't it? So if you go onto the Cancer Council Victoria website, I know they have a list of support groups, and actually I think they do it by location as well, so that will give you the option of joining a support group that might be appropriate in the area that you can access. You've mentioned pre-existing psychological issues, so it sounds like a support group might be helpful, but it sounds like it would be helpful to have to seek support from a psychologist as well on a one-on-one basis, since it can be more complex in that case.
Fantastic. Thank you very much, Dr. Pullay. I really appreciate your time, and thanks for that wonderful presentation.